Hi, I'm Steve Adubato. Welcome to a very important discussion we're having with a whole range of people dealing with COVID-19, the longer term, the challenges ahead. And one person who's been thinking about that day and night. And we're glad and honored to be joined by United States Congressman Josh Gottheimer. Congressman, thank you so much for joining us.
Thanks for having me, Steve.
Let's make it clear we're taping on the 13th of May. This will be seen later. Huge vote or votes coming up in the next few days. They could go either way. What's at stake and why does it matter to everyone, particularly long term?
Well, I think the big issue for New Jersey, and obviously that's who I'm focused and fighting for, is getting more resources back to our states, to our localities, right, to our towns, our counties, which will be essential to help with ensure that we have cops and firefighters and teachers, that we're able to pay our bills. I'm very worried about the state of economic affairs. We've had a health crisis that's still ongoing, and we also have an economic crisis. So we're really focused on both. This legislation also will fully reinstate the state and local tax deduction. So that's tax cuts for people, which I think are essential dollars into the pockets of our residents. And then on the health side, which was first and foremost, of course, it's more resources for protective gear for our frontline healthcare workers and all of our first responders. It's making sure that our hospitals and our long-term care facilities have what they need, and they've obviously been hit very hard. So it has many elements to it, many that are essential for New Jersey.
Congressman, one would think that in a global pandemic like this, that we would all come together, be together. And I'm not talking about singing Kumbaya together, but at least understand that we're all in this together. But here's what I've been thinking about, and I'm not the only one. To what degree do you feel your colleagues in the House and in the Senate who come from different states, other states that are not affected, hurt to the degree New York and New Jersey and other states around us are, to what degree do you think they genuinely are concerned and worried and willing to actually do what they need to do to help those in, dare I say, bluer states, more democratic states? Or does this have nothing to do with politics and I'm all wrong?
Well, I'd say one thing, and I co-chair a bipartisan group of half Democrats, half Republicans called the Problem Solvers Caucus. We've been getting together on Zooms 3 to 4 days a week. What's been consistent from the beginning of this, including the first package we passed in March, is how bipartisan this has been, how the country has come together, putting country ahead of partisan politics. And frankly, it's how we passed all these packages to date to help our small businesses, to help our people, help our frontline healthcare workers and our first responders, our heroes, and make sure we get direct support to individuals who are suffering right now, so many people out of work. So that's come, it's been a remarkable thing to see everyone come together. Now what you're seeing in the last week, which is a little disappointing, and I hope we get past it, is less of a partisan divide, but more of a regional divide.
Geographical.
And, it's a geographic divide, right? Some states saying, because you've got Democrats and Republicans in states like ours and in New York and others that have really come together. Louisiana, working very closely with Senator Cassie in Louisiana. People coming together who've been hit hardest, who've been in the eye of the storm, of the COVID storm, like we've been, from day one here. And they've come together, but you're seeing some who always expect us to be there for them when there is a natural disaster, as we should. We come together as a country. Some of them have said, well, I don't really want to support New York and New Jersey, despite the fact that they've got half the caseload. And that, to me, is not exactly in the spirit you'd hope for.
Congressman, how would you describe President Trump's leadership from day one and to where we are now, mid-May, and what needs to be done moving forward? How would you describe it?
Well, from a Jersey perspective, and if you look to the governor on this too, we've all really been trying to work together closely with the administration to help out Jersey. So, right, what I'm focused on, as ever, Steve, is how do we get resources back here? How do we get testing kits here? How do we get protective gear, face masks, and ventilators, and other things that are essential for our hospitals? We've worked closely with the administration to make that happen, to get out of the resources out of the stockpile, and that's been helpful when we were able to get it. The challenge is now is making sure that we actually have a national strategy for testing, because we still don't have the tests we need, and that's essential to reopening safely. We still are kind of on our own on some of the protective gear issues. And what I don't want to see is one state competing against another state for a ventilator, for protective gear, for tests. We got to come together and have a central plan help get those materials out, and to think about our supply chain so that we're ready if this hits again. And that does take. We're going to have a coordinated strategy on that. Everything from standards for sanitizing buildings and what we're going to expect from people. We need that kind of guidance. Now, I'll say this: each state, as we said before, and each sector have different issues, right? So there are regional and sector differences here, and so why that matters is that you're going to have different approaches as we are in New Jersey versus Montana. I would urge, and I've said this to all my colleagues, that, and this is your point, that we come together and make sure we understand if one part of the country fails, if the Northeast economy fails, it affects the entire country. And that's what I'd say.
Let me follow up. By the way, for any technical issues, I apologize, but anyone who's been watching broadcast or any media format, that this is a challenging situation for all of us. But here's the thing I'm curious about, Congressman. The long-term care facilities, you've been all over this. You have been challenging some of the long-term care facilities because a very high percentage of those who have gotten very sick and lost their lives are in those facilities. What is the problem? How could it ever have gotten this bad? And what do we need to do more to move forward? I'm sorry for asking 3 questions in one. Go ahead, Congressman.
No, I'm really glad you're bringing this up because it's heartbreaking. I can't tell you how many family members I've spoken to whose loved ones are in facilities where they're not getting information, or they didn't get information about how sick their family members were, or who what they were exposed to in terms of COVID, and how many facilities we know that just didn't respond fast enough with protective gear for all of their nurses and caregivers. And so therefore it spread fast in the facilities. They weren't separating out sick versus those exposed versus those who weren't exposed, who weren't communicating well. That to me is unacceptable. Those who didn't move fast enough to take care of their patients and loved ones, that's just not acceptable. Others have done a good job. So I don't want to paint everyone with the same brush, but we've seen cases in Andover, New Jersey, in northern New Jersey, where I represent, where it spread like wildfire, and I believe they didn't react well. And CMS, which the federal investigators came in and confirmed just how bad it was and how they weren't taking care of staff or taking care of residents and exposing them. I got a call on a Saturday night for body bags because so many had piled up. And it's just, it makes you sick when you think about that they were just behind the game. And we're going to need much tougher standards in place, much stronger state oversight. These are state overseen facilities. We've got a veterans home in Paramus, which I'm sure you've read about.
Yep.
It is heartbreaking. These are our veterans. 74 people have died out of about 300 residents who were there. More than 90% of those who've either had COVID or have COVID now, I believe we'll learn more when we look backward here, but they didn't act fast enough. The good news is we got the Guard in there. I worked with the governor. We got the National Guard in there. We got the VA in there to get more support. We got all of our local doctors from our best hospitals in the area here that have been in the eye of the storm. They went on site about 10 days ago to give us a read on what's going on and make recommendations.
Thank you, Congressman.
Stay safe and healthy, everyone. Okay. Thanks so much, Steve.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by New Jersey Sharing Network, Atlantic Health System, TD Bank, New Jersey Board of Public Utilities, Clean Energy Program, Seton Hall University, Operating Engineers, Local 825, the Port Authority of New York and New Jersey, Gibbons PC, and by Eastern Atlantic States Regional Council of Carpenters. Promotional support provided by Insider NJ and by ROI-NJ. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.